Good afternoon, everyone. So I'll be sharing briefly about the impact of what the ARISE network collectively we have all been able to achieve as we look into the next 10 and 10 and 10 more years. It's very hard to speak after Wafaya's, my mentor, speech. Very nice overview that you shared with us. A lot you covered, so I'll just highlight a few, just to emphasize that truly there is impact in the past 10 years. So, yes, our 10 years journey, where, as Prof. Wafaya noted, initial meeting in Boston included partners and friends from 6, including Tanzania, 7 institutions from Sub-Saharan Africa. We have had growth over time, and I think this room today is a testimony of that growth over the 10 years. We've been able to carry very important meetings over the course of the 10 years. In these meetings, we're very much delving into next steps, what to do as pertaining to the research as well as capacity building around research in this part of the continent. These meetings have been held in Dar es Salaam, in Boston, here in Ethiopia, and as well as in South Africa. And I believe, hopefully, so many other venues will be possible over time. Again, our network is committed to improving adolescent health of the young people and well-being, addressing nutrition and physical activity, sexual and reproductive health, but also mental health and well-being. For slides that have already been noted, I will not go into much detail. But essentially, the effort through the ARISE network that we're doing has been really to generate the evidence to state the problem or an understanding of the state of health of adolescents within this part of the continent. In that process, we've been also able to build cohorts of adolescents. Through these cohorts, we've been able to jointly build them. They are longitudinal, very communal, community-based, and out of this we've been able to pull data jointly, make the analysis, and this is usually done in the beginning where it is very done jointly in terms of thinking visionary about what is the data, coming up with a tool, and looking at timelines on when we can begin the data collection through these different studies. So definitely, yes, they have been unified, and wonderful to note that over the time, the data that we've been able to collect has provided us with a unique description of the health of adolescents. And it has also helped us understand the needs, the risks, and the relationships that really, in one way or the other, ideally are to inform interventions for ultimately improving the health and well-being of our young people. Overall, we've been able to build the opportunity, creating an ability to do studies. Also, that is a possibility to also do nested studies, do trials, and in this phase, we are excited to move towards the next stage of designing and testing interventions. But beyond starting interventions, we hope, and that is what we aspire. Generally, in our philosophy, it has been doing out an intervention, but also ensuring that communication goes all the way, translating the findings to get all the way to policy. And I think evidently, even formation of the policy think tank is evident to ensuring that that is one of our goals, that at the end of the day, all the work that we do, be it big or small, ultimately can be able to inform our practice, can inform our policy. So I'll share a few examples from Tanzania with regards to impact. What we call MEGA in short form, for meals, education, and guidance for in-school adolescents. This is a study that was conducted in Tanzania. I'm honored to recognize Professor Vuai from UDOM who was leading us with a team there. And in this study, we did it in a school setting, where we believe that schools are an ideal platform for trying and testing different interventions for improving health and nutrition of our young people. Wonderful to also note colleague DQ, who was also very instrumental, and colleagues from AAPH and Harvard and others. So what we did here is we provided, what I mentioned earlier, school meals, a lunch meal that provided at least 60% of the daily requirement, nutritional energy requirement for an adolescent in the school, but also there was gardening and in others, health education. And there was also community interventions where parents, caregivers were involved in the process because they had to be part and parcel. Very unfortunately, within our ARISE partner countries, it's only in Tanzania that we currently do not have an active, ongoing school feeding program, especially within the public school setting. In the school, in the boarding school, there is food, of course, provided. But in the day school, we do not have. It used to be there in the past. It was rolled out, or it was stopped. And so we are trying to see, hopefully, evidence such as studies from like MEGA can help bring back that policy, bring back to discussion, and push further for the agenda that we need to be able to provide school meals for our young people so that they can be more attentive, become much more nutritious. One of the outcomes we were looking at was the hemoglobin level, just the intellectually understanding and school outcome, general nutritional anthropometric indicators. They were among the key outcomes that we're looking for, but also looking at their understanding overall with WASH, understanding the interaction between WASH and nutrition, and also generally looking at educational outcomes. So these are the students in Dodoma who were able to initiate these gardens from scratch. As a project we provided, and we were able to, for schools that had maybe just an initial building, we were able to finish it up so that they have a functional kitchen. And with that, provided everything required, including water, so that the kitchen can be up and running. Community engagement was key, because then parents were able to organize themselves, ensure they bring in who's going to be cooking, put up their own roster, but also they contributed to ensuring that they also are bringing the food, because it's not part of the national program, so parents organized themselves, and as a project we were able to provide, subsidize the project, providing seeds and others and all other supplies so that these gardens could start. And in that process, teachers were very key. They participated by ensuring that, you know, they were very much informed in making sure communication, the education and nutrition literacy activities are taking place. So these vegetables were grown from scratch, and they were consumed by the same adolescents. So overall, from this study, what we have learned, and we see a great opportunity for even studying further and much deeper to be able to get even much more substantive evidence for hopefully circling back into policy to push for advancing, changing of the no food policy within public schools to hopefully bringing back a routine provision of meals in the schools. We see that this study in MEGA revealed that school-based nutrition intervention packages in incorporating multiple actions, as I've noted, have a potential of reducing double burden of malnutrition among adolescents in our settings. So this study has been published in the Journal of Adolescent Health, and further information on gardening program and nutrition education through other initiatives have also been informed by this study, and these include activities that we are soon to we began undertaking with other colleagues in an extension of a network, the Changemaker study, which we'll be doing with colleagues in Burkina and Kenya and Tanzania through the Changemaker project. Second example to the impact of our work collectively, this is, we call it Samia. We were cautioned because the president of Tanzania, you know her name, Her Excellency, our very own is called Dr. Samia Suluhu Hassan. So we were encouraged and advised if we can try and tweak the name a little bit, and we did that, but we still call it Samia. But now we call it Rutubisha Afya. So this is a study that again was done in Tanzania and in Burkina. We're very excited to share that it's another exciting opportunity again to enhance nutrition through supplementation of multiple multivitamin supplementation Samia was done in Zanzibar. Zanzibar, Tanzania and Burkina. So this is a longitudinal study conducted in Tanzania and Burkina. It was for 2 years. We were providing, to provide evidence for scaling up national food school-based micronutrient supplementation program. In this study, students in schools aged 10 to 17 were randomized into 3 arms. 14 schools receiving weekly iron and folic supplementation, 14 schools received multiple multivitamin supplementation, and 14 schools were acted as controls. Teachers were involved in the supplementation, exercise, and collection of the routine data. Happy to also appreciate colleagues, Dr. Professor Ali and colleagues from Burkina, as well as Dr. Innocent and others from AAPH for really spearheading this activity, as well as colleagues from Harvard. So what we found generally is this as a longitudinal study, we see that the Samia study has really informed scale up, in a sense that in Tanzania, although in the mainland we do not have within our policies provision of these supplements, but in Zanzibar, where it's one country but we don't connect, everyone is independent in terms of things that they prioritize for health in terms of our policies and guidelines. So Zanzibar had already enrolled a program for provision of this supplementation in school-age children, and therefore this study provided from our study findings have also been able to contribute towards the scale-up of that process in Zanzibar. So we're very happy to see that a contribution to the impact, where already in the country there is provision of that service, and therefore it was straightforward for the Zanzibar government to take up the rollout of supplementation for school-going children, adolescents in Zanzibar. With Burkina, I believe the team is in discussions with the ministries to look at possibility of also scale up at national or maybe sub-national levels as well. So we have learned from the Samia study that from findings from this study, we are very excited again through the same process are also informing what we are already undertaking through the Arise Nutrient project, which is also part of this network. Another example going forward is the Being Mental Health Initiative. So again, this one is a mental health project. We did this together with colleagues in Ghana and Tanzania, Professor Sam and Adam, as well as my colleagues Innocent and others, but also a lot of support from Charity Shuyan from Hyderabad, as well as Sachin and others from Harvard. So through the Arise network, we were able to implement this out of a call that came out of the Being Initiative. And the Being Initiative, this study was funded by the Grand Challenges Canada. The focus of the Being Initiative is to really bring around more awareness on issues of mental health among young people, and to try and understand what are the reasons, what are the drivers, through doing an initial landscape analysis. So this project involved 12 countries, and we were fortunate that because we were part of the Arise as the 2 countries, AAPH in Tanzania and Ghana, we were able to jointly apply and implement this study together. So the first phase was to do a landscape analysis, understanding the state of mental health among young people in Tanzania and Ghana, and using different platforms, working with different stakeholders, experts in mental health, to come up with what are the key drivers of the main issues around mental health that we would find from the desk reviews activities and a lot of consultation workshops. In these processes, youth were very much part of the process. They were involved in their own groups of 8 to 10 young people, also sharing their perspectives. They were also involved in some of the sharing of information through the process. So the components, this study overall has the research component, there is a design, and there is also an implementation of innovation, but also there's an aspect of the ecosystem. So I'm very happy to note that through this Being initiative, we were able to do the first part of really understanding the context, and out of that, we were able to findings from the Being initiatives contributed towards the funders identifying those priority stresses or drivers of mental health, identifying the key priority mental health issues within the countries, and also then using that information to design the next research questions for a call that came out that most countries, including ourselves, we have applied. So stakeholder engagement that took place in various times during the past year were culminated with dissemination of activities. What you see on the far left is a dissemination activity in Ghana, and then at the bottom we were also able to present findings of this study in a conference recently in Sweden. So findings from our Being initiative hopefully will also be used to also add into the stakeholder groups that we will be working with, understanding more, because we also have a mental health component in our DASH project. Again, through extensions of our collaborations, we are working with colleagues from KI, Karolinska Institute, as I also noted, with the Changemaker project, funded with the same funder like the Arise Nutrient project, and we'll be doing this study Changemaker for promoting co-designing of sustainable health interventions among young changemakers, for using the risk of NCDs, and this will be in Tanzania, Burkina, and in Kenya, as I alluded to earlier. On the picture was the first team launch of the project in February this year in Nairobi. Overall, collectively as a network, as Amani has presented, we have been working together to share our work and our findings through different reports, including scientific publications, policy briefs. For those that were in the policy meeting yesterday, Professor Ayo noted some of the policy briefs that Prof. Wafai and team led in sharing part of our work. But we also have routine annual events where we come together and share scientific findings. In those, we always make sure we have an opportunity to discuss next steps with research and training going forward to advance the focus of our work. So with capacity building on research and methods to build the next generation of public health continues to be key. We had a training yesterday here in this room on issues and areas around adolescent health, and this will continue to be core and central to ensuring that within our group, within our network, we're able to share, because there's a rich expertise of different players, to be able to translate the knowledge to ensure that we continue in that process, building that next generation of public health experts within our training institutions, within our research institutions, but also within our government, because these are the leaders, as noted earlier by our think tank members. They are the leaders today and the leaders of tomorrow. Moving forward, getting towards the end, in all our work, we strive to make sure that young people are in the core of the planning process. And examples of this have come from the small examples I've shared, the Being initiatives, ensuring that co-designing process involves them, ensuring that they're part and parcel of looking at how really can we start a school gardening program while we also have our classes from morning to whatever time of the day. So that is ideally the way that we will continue going forward to ensure that the voices of the young are represented in here, continue to be part and parcel of forming the process. The Africa think tank that has already been launched today, and I would say let us put our hands again together and really thank our think tank members for appreciating to provide us with your guidance, your leadership over the course of the time in the periods of our 2 projects and going forward has been launched. Much has been said earlier. I will not go into more detail, but rather to thank you and to look forward to continuing learning from you and help and hearing from you, guiding us in this process, so that at the end of the day, the research that we do is translated into practice to improve our policies. Honorable Minister mentioned here she would have no problem even if guidelines and policies would stay for 1 year, only if they are informed, and they are informed by research and the right data with the right people at the right time. So we believe with you, we will be able to achieve all of that. So going forward, as a network, definitely I've noted adolescents. We hope we'll be able to continue empowering them. They'll be part and parcel of the change and of the driver. We also believe or continue looking into building the adolescent health research capacity so that they become part and parcel of the process in co-designing in the interventions and testing the interventions, so that at the end of the day, they're also owning part of that process. Advocacy on policies around adolescent health will continue to hold a significant part of our work. And in all this, as Professor Wafai noted, it is through our collaborative nature, partnership, and ensuring that everyone's voice is heard, and we're discussing things from the beginning, as we have been doing. I would say that is one of the greatest impacts of our network. The collective effort, the collective thinking, PIs are usually checking around with each other about different ideas before they even trickle down to the rest of the team members. So I would like to maybe stop here. This is my last slide, but really to say, I'm a Segnalu. And so I know my time is up and Joy is going to eat me. But as the leader of the Africa Academy for Public Health, I think I wanted to spare this in the beginning, so I could circle back and say, I stand on the existing protocol. That was very well said by Professor Wafai Fauzi. But really to thank each and every one of you. You make this network be what it is. Very much grateful to you all coming together back in Boston 10 years ago. Thank you very much, Professor Wafai Fauzi, for your leadership. Professor Ayo, Professor Yemane, thank you for hosting us. Professor Mosa Mushabela, in absence, Professor Richard Adanu, well represented by Ado Manu. In absence, Professor Gwatude, very well represented by Dr. Justine Bukenya from Uganda. From Nigeria as well, Professor Angela, thank you very much. From Tanzania, Professor Vuai, and some members that are not here, we still want to say thank you very much. From our colleagues who have also been very instrumental from the beginning, Heidelberg University, Professor Till Baringhausen has been core and central to the ARISE network from the beginning. Thank you. And everyone who has come from the Europe behind you with these projects. I will not mention everyone, but thank you, Professor Magda. Thank you very much, Shuyan, not in the room maybe, from Charity. In absence, our very good colleagues, Jacob and Mike, who really have also been very instrumental to our 2 projects, Nutrit and Dash, who are not here. Also want to appreciate them. But also to thank everyone from all other partnership, Jan and others from other institutions. Thank you very much again to the think tank. And to our young people, can we see a raise of hands, clap, a shout? Thank you very much to Fik and others. All of this work truly happens every day because there are some people that almost don't sleep. From Heidelberg, led by Christine, Angela, and others. From Harvard, Sachin, and others from AAPH, Amani and everyone, and Innocent, but also from all other partners. I don't want to take too much time because I know we're also going towards a lunch, and I would like to stop here and thank my colleagues from AAPH, and thank very much our hosts again. Professor Yamane, thank you very much. Dr. Hannah and everyone for really coordinating and organizing this meeting and having us here. I'm sorry if I left anyone, it wasn't intentional. I'm just trying to not spoil the very nice occasion we just had a few minutes ago. Thank you very much.